I didn't grow up hearing words like anxiety or mental health. Back then, people didn't talk about things like that. My dad just had what everyone called bad nerves, and that was the polite way of saying everything was a bit of a mess. Nobody explained it, nobody named it. It was just life. And somewhere along the line, I ended up dealing with my own version of it too. People always say, reach out, ask for help, but nobody tells you what actually happens when you do. When I was in my late 20s, the GP kept trying to talk me into counseling. But get this, when I finally agreed, suddenly it was, well, you need to fill out a few forms. And when they say a few, I dread to think how many they'd call a lot. So I filled them out, feeling like I was repeating myself on every page, and sent them off to the right department. And considering how much they'd pushed me to do this, you'd think I'd be seen fairly quickly. I couldn't have been more wrong. I waited 2 years, 2 whole years, and then I finally got an appointment for an assessment, which was basically answering all the questions I'd already filled out, but in person. 5 or 6 assessments later, they gave me a diagnosis: anxiety, depression, agoraphobia, EUPD, BPD, blah, blah, blah. Just words on paper. I remember thinking, what the hell? All that for a diagnosis? I felt forgotten. I went back to the GP and they told me I was now on a waiting list for CAT, cognitive analytic therapy. And the thing with CAT is that it's meant to go right back into your past. It's a talking therapy that digs into where everything started, how your patterns formed, all the stuff you've spent years trying to bury or mask, which is great in theory, but in reality, 14 sessions were never going to be enough for me to build the kind of trust where I could actually stop masking. She never really got to see the hurt I hide, because how could she? We barely had time to scratch the surface. And that's not her fault, it's the funding. They can't offer more than that, even when it's obvious some people need longer. So you end up doing this deep emotional excavation on a timer, and when the sessions run out, that's it. You're done. Ready or not. After the sessions were over, that was it. No follow-up. No, let's check in. Just done. So I went back to taking the medication I'd already been prescribed to help with my emotions. And honestly, that was the only thing that actually carried on after the therapy ended. There was no big moment, no epiphany. Nothing like the dramatic breakthroughs you see in films where someone suddenly understands their entire life in one session. Real life doesn't work like that. Mine definitely didn't. It was more like, okay, that happened. Now what? And then COVID happened. And that threw the NHS into the deep end. The knock-on effect is going to be huge. When the world finally steps back and looks at the bigger picture, they're going to see just how much damage that level of isolation did across different generations. Kids who missed milestones, teens who lost years, adults who were barely holding it together, older people who went months without seeing anyone. Everyone was affected, and the mental health system has been trying to catch up ever since, but you can't catch up on something that big overnight. And that's why so many people feel stuck now. Not because they're doing anything wrong, but because the system is still recovering from something that shook the entire country. And the strange thing is, after all that waiting, I didn't walk away feeling like I'd failed. I knew I'd tried. I showed up. I did what I could. But I also knew I wasn't going to let that mask slip, not properly, because once you open that can of worms, you can't put the lid back on. She knew it too. I could see it in the way she looked at me sometimes. She could tell I was holding everything together with this neat little mask, and it never cracked. Not once. And I think she wanted it to. Not in a bad way, but in a, I want to help you way. But I couldn't. Not in 14 sessions. Not on a countdown. Because deep down, I knew exactly what would happen. The minute I let all that stuff out, the real stuff, the sessions would end, and I'd be left sitting with it on my own. No support, no follow-up, just me and a pile of unfinished business I couldn't unring, like that proverbial bell. So I kept the mask on, not because I didn't want help, but because I knew the system couldn't hold what would come out if I actually opened up. And that's something people don't talk about. Everyone says, be honest, be vulnerable, open up. But nobody mentions what happens when you do that. And then the clock runs out. So that's it. No big ending, no neat conclusion. Just the truth of what happened and how I got through it. And if you're starting your own journey, wearing the mask tight, not quite ready to let it slip, I've been there. Trust me, I see you. I know it's a lot to carry. Just remember, you're doing what you can in the safest way and in the right way for you. If you want to hear more real, quiet stories like this, you're welcome to stay. And if someone else is carrying their own mask a bit too tightly right now, you can share this with them.